Hi guys, what's up? It's Mansi. Welcome back to my channel. So as you can see by the whole setup, this is a very impromptu video. I did not plan on making the video. Maybe I just woke up today with the need to talk in front of the camera. I don't know, it's been a while. I have not posted a video in quite a while. Medical field is a sort of field that requires certain qualities that would definitely be needed for you to succeed in the field. So for anybody who was curious to know what makes a good doctor, even though yes, it's a very general thing to mention, and I would not say that this goes on to say that if you don't have these qualities, you would make a horrible doctor, because let me just tell you that I also don't possess all of these qualities. But still, as a general rule of thumb, these things that I'm going to tell you are going to be considered as a very good plus point. So on that note, let's get started with the first quality that I think is the most important for every doctor, a good doctor, to possess. Having good people skills. Now, whenever you are seeing a patient in the hospital, it is very important for you to make the patient comfortable in terms of, whether it's talking or them telling you about their complaints, and you have to get a lot of things out of the patient without them knowing even. So this quality of having the sort of communication skills that would make the patient comfortable at the same time you would also be doing your job, this is something really important. And if you are good with people, if you can really make them open up very easily, I think that would go in a very plus point direction of you making a good doctor. So this is the one thing that is very important. As a doctor, you have to be present all the time, and you have to be very attentive, and you have to make the patient comfortable in every sense. Working in teams and being comfortable with teamwork. I think this is another quality that every doctor should have. And I know that most of us actually see doctors as sitting in office alone and then seeing the patient on their own, and where's the teamwork part, right? But no, it's actually a very subtle teamwork that works, and there's a whole system. So when we're seeing the patient, we have to be very comfortable with also communicating our doubts. There's a lot of integration of other fields with the patient that you are seeing, especially in a trauma setting. When there's a patient coming in and you have to make a call very quickly, you need other people to be your eyes and ears as well. You need them to tell you what you might have missed, and then you have to work together. It's like a very robotic experience actually to work in emergency medicine, because everything is happening so quickly. It's like, it happens in a blink of an eye. Having a good hold of your emotions. I think this is another thing that a good doctor should always possess, because there has to be a balance between being empathetic to the patient and then also having a sense of professionalism, that you don't lose your sense of judgment. Before we move on, guys, you know that I take classes on Unacademy, so you can join me in these free live sessions on Unacademy, and I take these classes at 9 p.m. I've provided the link below. And Unacademy has a special Republic Day offer coming up from 25th Jan to 27th Jan. So this is a very limited period offer. Get extra months off on your subscription plans. So you can get these upgrades if you need, and this is a limited period offer. Like I said, if you want to avail this offer and get extra 10% off, you can use my name as a code, Mansi Single, and I've mentioned it right here. So I hope this helps anyone who's looking to upgrade their plan, Plus or Iconic. So this is something that also goes towards the way of you becoming a good doctor. If you're good with that, this is something that a lot of us actually struggle with initially, I guess. When you're a medical student, part of your medical training is actually also going to be this. Breaking bad news to the patient's families, or just seeing the family members in general, might just trigger a very emotional, stressful response for a lot of us. But after your MBBS, I think you will get used to it. But if you are a little bit too sensitive in terms of seeing people sad, I think that would not work well for you in future. I cannot stress hard enough the need to be organized and disciplined in this field, because it is a very long course, and it's going to take you about 10 years to actually get to a point where you can say that you're successful in your field and you have a sort of expertise in your field. So being organized and being disciplined is actually going to help you maintain a sort of consistency that you need to become a good doctor. If you are good at looking at the long-term end result, and if you are good at looking forward to that, then yes, this field is exactly right for you. These were the 4 qualities that I personally think are the best qualities that any doctor should possess for them to be successful in their field. But you can share your own opinions as well. You can comment below your thoughts about this. And again, to make clear, this does not mean that if you don't have any of these qualities, you would make a horrible doctor. It's not that. It's just like I said, a very textbook sort of thing. It's just a means to make you more confident if you do possess even 1 or 2 of these things. So I hope you liked the video. Please don't forget to hit like and subscribe if you liked it, and I will see you guys soon. Bye bye, take care.